Good morning, everyone, and welcome back or welcome anew to the Maine Public Health Association's annual conference. We're excited to be joined today by our team from the Maine Immigrant Rights Coalition. We have Mufalo Chitam, Executive Director, Fatima Saidi, Grants and Contracts Manager, and Jayde Biggert, Project Volunteer, and also a student at the NYU Silver School of Social Work. They will be presenting on growing organizational capacity, strengthening our ethnic community-based organizations during COVID-19. Before they begin, just a few more reminders of the opportunity to have closed captioning underneath your video. A reminder to please complete the evaluations using the feedback button for this session and all the sessions you attend. That's especially important if you're seeking continuing education credits. And if you have any questions for our presenters, we will take those at the end of the presentation, and you can enter those using the Q&A button. So without further ado, I will turn it over to our presenters. Thank you for being here this morning.
Thank you so much, and welcome everyone. Thank you for joining us for this session. And again, we're gonna run through some of these slides, and hopefully we can be able to leave enough time to get questions and answer, some of your questions and also, some of your comments. And so we can go to the next slide. Thank you. So today we are going to talk about our work as the Maine Immigrant Rights Coalition. Who are we? So the Maine Immigrant Rights Coalition is a coalition that was started in 2005 and has since grown from 20 organizations to 83 organizations. And what we do basically is threefold. We advocate, and then we do collaboration and information sharing. The coalition is a statewide organization that majority of its organizations are based in the Cumberland area. But we do have communities that have been growing in the mid-coast area. We have some in Brunswick, Augusta, the Millbridge area, and then growing into Bengal as well. And then in the southern part, we do have organizations in the Saco, an organization, but communities in the Saco-Bedford area, and then pockets in between the greater Portland area. And so, like I said, our work basically has been, as we have seen the influx of asylum seekers come, particularly in 2009, but that growth also started way back in 2005, and that's how our organization started. But majority of our organizations are serving immigrants who are asylum seekers, who are refugees, and Maine is a refugee resettlement, as well as all other statuses. And so today we're going to talk about the work that we've done. We're still doing that work because we're still in the pandemic, but how our coalition came together in 2019, when we saw an influx of asylum seekers come to Maine, and then when the pandemic hit, we used the best practices that we learned, on organizing in 2009 to help support our communities during the pandemic. And so with that said, I will go to the next slide and talk about the work that we did as ethnic-based organizations as we saw, the pandemic hit our communities, the most. Jayde, you want to take it over from here?
Sure, thank you, Mufalo, and it's great to be here with everyone. So I'm going to just ground us in kind of the basis of this work and highlight some really important points about the racial and ethnic disparities that were kind of driving our advocacy and our work during the pandemic. So the graph that we've got here is taken from some data that was released during the beginning of the pandemic, and this was June 2020 was really the height of where we saw the greatest racial and ethnic disparities in the number of COVID-19 cases. And as reported by the Portland Press Herald in June 2020, Maine actually had the highest racial disparities in the number of COVID cases in the nation, particularly among the Black and African American community, and how that community was being most disproportionately impacted by the pandemic. And so here, just to walk you through, we see in the orange bars, we see the percentage of the population that identifies in these different racial and ethnic groups. And then the blue is the percentage of positive COVID cases cumulatively. So right from March to June in this graph that we had seen. And the breakdown by race and ethnicity really shows you, particularly in the Asian and Pacific Islander, the Black or African American, and the Hispanic groups, there was a significant disparity between the percentage of the population and the percentage of the cases that we were seeing where race was reported. And so we really zoned in on the tracking the racial and ethnic disparities within the Black and African American racial category, because this was where we saw the largest disparity in the number of cases versus the population. So this graph shows the change in cases over time with respect to the population. So as you can see, the percentage of Maine's population that identifies as being Black or African American is just less than 2%. But in June 2020, we can see that that was really where the peak of the disparities were, where almost 30% of the cases being reported were within this community. And as time has gone on, there has been a steady decline in these cases. And I think that it's important to note that this decline has been because of the work that so many of these community-based organizations have been doing in supporting these communities, making sure that they had access to appropriate healthcare, quarantine space, and education. And although this has been declining, it's also important to note that the gap still does exist. And we see right at the end, that's September 2021, and there is still a gap between the percentage of the population and the percentage of the cases that we are still seeing. So in looking at the impact that the pandemic had on Maine's immigrant community, right from March 2020, we had seen that there was, before any of this data was released, that there was a disproportionate negative impact on the immigrant community and Maine's communities of color. And here are just a couple really poignant reasons why this had such an impact on the immigrant community. The immigrant community in Maine is at an increased risk of exposure to COVID-19 because of their working conditions. Many within this group might work frontline jobs, and so they are classified as essential workers. And particularly in the beginning of the pandemic, were not able to work from home. They had to be out there, often in workplace conditions that were very poor with no social distancing. And this also relates to the economic impact because many of these individuals were not able to take that full 2 weeks to quarantine if they were exposed because they risked losing their jobs or were not financially supported during that time. We also saw from very early on barriers to testing, particularly the cost of testing in the beginning, where to get tested and information about that. And also just a lack of access to comprehensive healthcare. There's been a lot of research, not only during this pandemic, but throughout America's history due to institutionalized racism and systemic racism, there being a disproportionate lack of access to healthcare, particularly among communities of color. And we also saw because of different housing setups, for example, multi-generational households, or just living in congregate settings because of the lack of affordable housing throughout the state of Maine. That was very difficult for our communities, should they be exposed or contract COVID, to isolate or quarantine effectively. Often they, shared living spaces and weren't able to remove themselves from their family members. And so this led to prolonged periods of quarantine, and also, again, linking back to that economic impact, having to support the family and having to support yourselves throughout this entire time while not being able to return to work. We also saw educational gaps. and particularly the digital divide when classes moved remote or moved to a more blended model later on in 2020. Many immigrant children had difficulties, again, finding that space in the home to do their work, have access to technology, a laptop, internet. And so we saw that these gaps that already existed within the education system were being exacerbated even more through the pandemic. We also saw immigration restrictions, and this has been an ongoing issue that the pandemic really just highlighted, but different immigration statuses, ability to access certain public benefits and resources really just became heightened as well. And again, especially during the Trump administration, the pandemic was kind of used as an excuse to bar entry of a lot of immigrants from the country as well, and also prolonged processing time and things like that, which also did have an impact on our community and their ability to obtain work permits and certain public benefits as well. And we also saw language barriers and the misinformation, perpetuation of misinformation as well. So this was an area that we worked really hard to make sure that we had translated material that was out there, and also up-to-date material, because the information was just changing so quickly throughout the pandemic, and then especially later on when we saw vaccines being distributed as well. And then just to touch on this a little bit, but later on in the pandemic, particularly at the end of 2020 and definitely this year, we've seen a very inequitable distribution of the vaccine as well. And we like to kind of frame this as, rather than emphasizing that Maine immigrant communities or communities of color are hesitant and don't want to take the vaccine, we like to reframe it as, you know, there are all these barriers and institutional barriers and systemic barriers and historical barriers that are in place that limit the amount of access that these communities have to the vaccine. And so our response kind of centered in four main areas, and some of which we're going to speak about more in depth today. So the first one was community and cross-agency collaboration. So right from the beginning, we did what MERC really does best, is convene all the relevant stakeholders. And we did that not only at the grassroots level, but also with larger mainstream organizations, CAP agencies, state departments, and even, you know, sometimes at the national level as well. We also focused a lot on education and awareness, and again, making sure that information was getting out in a way that was culturally and linguistically appropriate. We did a lot of advocacy, particularly around racism, and making sure that people were aware of the impacts of systemic racism on access to healthcare and how that was disproportionately impacting communities of color in Maine. And lastly, we also did a lot of financial and administrative support, particularly for smaller ethnic community-based organizations, making sure that they had access to the same funding opportunities by providing that fiscal sponsorship and technical assistance support as well. So one of the types of collaborations that I'm really going to hone in on and focus on today, because of its unique nature, is the social services referral system. So this is a system that was set up probably quite early on in the pandemic, and is something that we are actively working towards adapting and seeing how we can use this post-pandemic and in vaccine distribution as well. So this is one of our earliest posters or flyers that we made, just highlighting the main aspects of it. So what it was is really we saw all of these issues and all of these problems that the immigrant community and other communities in Maine were facing when they tested positive to COVID-19, when they were exposed, and really just they had no way of accessing support or going to a central place and making their needs known and getting referred to an agency that could support them. So this is what this whole system was about. It was making sure that those individuals didn't slip through the cracks and they were connected to appropriate agencies that would be able to speak their language, that were trained in, helping them access certain benefits, that were from their home countries, that their service providers looked like them, their service providers represented them. And this was a collaboration between, again, all of our ethnic community-based organizations on the grassroots level, but also, larger statewide community action partnerships, CAP agencies, as well as the Maine DHHS, the Department of Health and Human Services, and the CDC as well. And this is just I tried to make it simplified. Sometimes it's a very complicated process, but I wanted to kind of just lay out how this referral process would work and highlight some of the strengths and some of the pieces that we really advocated for along the way. So when a positive case was identified in the community or someone was exposed in the community and they needed specific help to access, for example, food, a safe place to quarantine, medication, transport, testing, really anything that you might need to access if you have to stay home or stay somewhere in a safer place for 2 weeks while you recover from COVID. So this case would be identified and they could refer themselves, they could have a friend refer them, a community leader, really anyone could refer them by filling out a form or sending an email to the DHHS COVID social support team. And they would screen this, the DHHS team would screen this, looking particularly at the type of needs that the person expressed, their demographics, so like their race, their ethnicity, what language they spoke. And depending on these, they would refer them out to CAP agencies, or they would refer them to us, to Merck and Catholic Charities. And that was kind of the central part that I was involved in. And we would receive referrals, particularly where the home language was identified as something other than English, or if the person was from one of Maine's communities of color, or if they explicitly stated that they were an immigrant, their home country was from somewhere else. And when we received these referrals, again, we would look at them and try and match them up with a community-based organization that would be able to best serve their needs. So if their home language was Portuguese and they were from Angola, then we would contact, the Angolan Community Association of Maine and make sure that they were being served in a way that was culturally appropriate. And that primary agency would then provide the social services to the positive case. And they could also be supported by a secondary agency, or for example, if the person needed a safe place to quarantine, they couldn't quarantine at home, or they didn't have a home to quarantine in, then that we could also loop in the quarantine shelter to also provide those social services. And all of the support was then funded and supported by the DHHS as well. And that was also where Merck provided kind of a channel, especially for organizations that didn't have nonprofit status or didn't quite have the organizational capacity to handle the state and federal reporting that could be quite cumbersome and quite tricky at times. And one thing I really did want to highlight in this whole map was specifically the food support program that you see on the bottom here. And that was a program that Merck really got involved in towards the end of last year, seeing that there was a large need for food support. And this is something that, we see often again and again during emergency situations, such as in 2019 at the Portland Expo, when we were welcoming the newly arrived asylum seekers, is that there's always a lack of culturally appropriate food. And so this was definitely a need that we noticed during the pandemic, and we tried to set up the system that could help families at home, but also families in the quarantine shelter that requested such food support. And I think this is just, again, it's often something that is not really thought of or taken into account. But it's so important, especially in this kind of situation where it's not, not only important for physical health and recovery, but it's so important for mental health and that connection to culture and the sense of comfort and home that people need. And from December to right up until June 2021, we supported about 250 households with food support during their quarantine. And this is something we're really proud of and something that was really born out of the social services referral system. So overall, just wanted to highlight the strengths of the system and really how unique it was to Maine, and how I think this whole system and this collaboration and this back and forth and this refining of the system and everything that really happened here is just such a testament to how incredibly strong Maine's community is, and especially Maine's immigrant community, and how incredibly connected they are as well, and how this can help us in the future to move forward through other emergency situations and to just maintain the well-being of these groups, even post-pandemic as well.
Thank you.
Thank you, Jayde. I can go next. Or Mufalo, did you want to say something?
Oh no, I just said Fatima.
Okay, thank you. So I can go next. First of all, thank you, Jayde. Hello, everyone. It's a beautiful day outside in Maine, so we don't get many of these in the winter, so enjoy your day. I would like to talk a little bit about our capacity building today at Merck. When COVID-19 started in the state of Maine, Merck, as Mufalo talked about, we're a coalition, we're a strong coalition, and we're rapidly growing because our population is growing, the people who we're serving. So before I talked about Merck, I want to say my connection to Maine a little bit so you have an idea. The first time I came to Maine, it was in 2013, and I came as an international student from Kabul, Afghanistan to Bates. Maine looked very different then, and the population then, the population of immigrant and refugee were roughly around 40,000 people. But this year it has grown to around, I think it's roughly around 65,000. So with that growth, organization or coalitions like our coalition has to grow in order to provide the services that Jayde was talking, and we have. So when COVID-19 started, at the beginning of COVID-19, our member organizations were around 53 organizations, and now, as Mufalo said, we are 83 organizations, and every week we get a new organization that wants to be a part of our coalition. So with that growth meant that Mufalo, as one person at the beginning, hired Jayde, and the reason Jayde is she's not just a volunteer. She did all of this work last year, so that's why it's her work. So Mufalo and I were just here clapping for her and very proud. At last year around December, the end of December, I was hired. So my position is grant and contracts manager. As Mufalo said, we are 83 member organization, and out of 83, we have around 21 ethnic organization, and out of that, we have different. A lot of them don't have the letter from IRS to be certified a nonprofit organization. So we try to help them at Merck so they can apply, and I am. Mostly my role is to help all our ethnic organizations to get the funding, do the reporting, do all the things. So I can do all of that so they can provide the services to their communities. Currently, we have 6 different ethnic organizations as our sub-grantees. And we have 2 different programs actually with the COVID relief program, as Jayde was talking. So we have the vaccine and we have the social support. The social support has 2 parts: we quarantining and putting people in the shelters, as Jayde was talking, and then the other part is providing food, culturally appropriate food. And the other programs that we have is trying to get our ethnic communities to get vaccinated, and it's hard, and it's just but
they are doing great, and we have vaccinated thousands and thousands of people across Maine. And I am so proud of all our ethnic organizations. And we have 2 meetings weekly, bi-weekly, so Wednesdays and Fridays, and every single time it's just I felt so amazed by how hard they work. The next position, that was Jayde's position, and now we have a new manager actually, and her name is Madeline Saucer. I hope I pronounced her last name correctly. She's doing what Jayde's doing, but also more than that, because we are, as Mufalo talked, our work is really, there is a type of work that we do, and also a lot of our work is very reactionary. What's happening in America, what's happening in this state and the state of Maine, and what's happening internationally. We are currently thinking we are in the process of probably having over 100 Afghan families coming to Maine, and just what's happening to the Haitian community, and it's like all of these things are. So that's Madeline's position. She's also still doing the referral system, ordering a lot of Chipotle. So she's probably, I'm so happy I don't have to do that, but she's amazing. So, and the other, our next one is finance and operation. So this one is, Mufalo and I are very happy that she joined. Her name is Carrie Store, and she joined actually last week. So we are so happy because Mufalo and I have been juggling a lot of the finance part of our work. We do have someone who is contracted with us, but we are just so relieved so she can do this. And when we're talking about a coalition, there is a lot of work behind the scene to be done, and so she's going to do all of that. And our advocacy manager, we are actually having 5 interviews later today for our advocacy manager, and we are very excited. And as the population of immigrant and refugees grow in Maine, we need to make some changes in the laws that are preventing to have better lives, or creating laws that are not there, that are essential to the immigrant population or things. Also policies and other resources that we don't have them in Maine. Also, one of the things that I was so grateful this summer, when Jayde was almost forced to go out of America and go back to South Africa, I'm sure she was very excited to see her family, but there was a lot of work to be done. And I was really grateful that we had 4 interns from Bates College with the purposeful work. And Jayde and I are an alumni of that program. We both did it 3 years in a row. So, and all our interns, Aliana, Ashka, Saidi and Zoe, they were amazing, and they helped Mufalo and I during interviewing, all of the things this summer. So again, yeah, so we are growing, and I'm sure we will, there are probably things that I'm missing that I have to mention, but there's a lot happening. Again, thank you so much.
Thank you. Thank you, Jayde, and Fatima, thank you for that. You know, what you have seen, what you've heard from Jayde, heard from Fatima, you know, is basically showing, you know, the impact of our work. We all speak, I'm always the one talking about, you know, folks are like, well, come follow. There's 83 organizations behind me. And Jayde, myself, Fatima, and now Kiri and Madeline, you know, we're just little people behind a machine. The impact that we've been able to do, and we've seen, you know, the work of when you invest in communities, they know best how to serve their people. And what we've done in the last 2 years, starting from 2019, was push systems to put money to where issues need to be moved, and that's in the community. My favorite phrase is, you know, grassroots has to be grassroots. But we as systems have to figure out how to be able to support those grassroots, because there'll always be somebody coming in at the bottom. And that means that there's somebody that has to be a touch point. And so our work and our impact is growing. But what the pandemic has done is has moved us in a way where we can see communities and people that need to be seen. Our communities of color were affected the most. Somebody asked me, a couple of weeks ago, oh, I guess now the disparities, there should be, the disparities are not, there's no longer disparities. That can never be solved because the gap will keep growing. Unless, again, this is embedded in our historical, racial history of the United States. And so we can never solve the disparities. COVID just shone a light on disparities. They're historically there. Issues around housing, issues around unemployment in our communities of color. Immigrants, were grandfathered into the historical disparities. And so what we've been trying to do in the last 2 years, since 2019, is empower the grassroots so they can be able to support their people, empower them financially, empower them with technology, empower them with education. If they're educated, they educate their people that keep coming in, but they keep moving people, from different levels. We talk about people that have come. As I'm speaking today, there's almost 500 immigrants in our wellness shelter in Portland. We now have Export 2.0. We're going to use the systems that we have built in this last year to support those communities. Merck is calling a meeting this week with our stakeholders, with the governor's office, with DHHS, basically to say, we have the platform that supports these communities. Let's use that vehicle to support these immigrants that are in hotels right now. Yes, we will not build houses tomorrow because housing is an issue, but we can find ways of moving those folks in different parts of our communities. We now have a very strong, system within the state of Maine because of the COVID referral system that Jayde was talking about. And so we can move those systems in another town. We're looking at, the Augusta area. We're looking at the Saco Bedford area. There are even other pockets. I know of the communities in Camden that have said, well, you can bring people. We can't just bring people there. We have to bring the systems and the resources to follow those people. If they see those, we have an obligation to talk to our communities, but they have to see the resources there. They have to see a community there that looks like them. And so our impact is to build ladders that connect grassroots, to systems. And so we do that, by pushing, the funding, by pushing institutions, mainstream institutions to work with us. We also are not in the business of being replaced by men's system. We are in the business of collaborating, which is why our work is to collaborate, our work is to inform, and our work is also to do institutional organization. And so our impact, we've seen our impact in this last year, but it's only growing. As you heard from Fatima, the census right now is projecting close to, in combination of the different communities, almost close to 100,000. When you have to cater in, and when you have to factor in, our immigrants, not our immigrants, our international students that are in colleges in the state of Maine. And so we actually using that partnership with Betts College, we were able to create, actually refine our resource link. Jayde talked about some of the work that we did. We created one central place where you can go and find, culturally appropriate educational materials. At our best, we are translating into 17 languages. The 17 languages, I get asked, why did you pick the 17 languages? The 17 languages are the primary languages as well as the secondary languages. They are languages within languages in communities. But when we looked at what made the most impact was to figure out which languages folks spoke. And that's how we came up with these 17 languages. And so during the pandemic, every flyer that Jayde just showed you, one of the flyers, has to be translated in 17 languages. And if you ask me the cost of that, I'm just about to send a check to our providers. That's about, we're talking between 2,000 and 5,000 every flyer that we have to translate. But why we do that is just wanting to make sure that our communities are informed, are educated. Jayde has done an awesome job, and now Madeline is doing that work of, reproducing flyers and information into simplified, chewable, medias that our communities can be able to understand. When COVID hit, I remember the first flyer that came out and like, what is COVID-19? It was so, medically, worded, and I'm like, how will my people, even understand? I speak English, I can't even understand this. But with this partnership and the referral system, we've been able to work with CDC, with their epidemiologists. They look at if we get a flyer, Jayde will like, well, let's rip it apart and make it condense it into half a page, and then they look at it. No, this is technically not right, or this is medically incorrect. But this partnership has built us to a place of where we can use these systems to respond to any pandemic, to respond to any systems. You can transplant this referral system in education. You can transplant it, in our business, in all the different sectors that serve our people, because they're connected to the grassroots. So this referral system, you're looking at me and just saying 24/7, absolutely 24/7. You see emails flying in and out. You woke up, you didn't sleep. It's 24/7 because folks are, submitting, requests for need, and then there's somebody, picking it up and figuring out which community needs this. One of the things that we saw in last year was the growth of other ethnic groups that are not represented, that were not represented within our sectors. We saw the Jamaican community come in, as part of that work. We saw the Haitians come in. We also saw with newer organizations like a Unified Asian Communities serving other Asian populations, the Chinese, the Japanese. And so when we get a referral and it says, who speaks this language? And then we're like, going through with Jayde, like, who speaks this language? Where can we find that person? The reason why we do that is because of the cultural education, the cultural knowledge that somebody who speaks the language can be able to help the person who has COVID or who wants to get vaccinated understand why they need that. Or they can also just share with them things that they wouldn't share with me because I don't speak their language. I don't know, what their challenges are, what their history is. Somebody who comes from their community can identify with them. But with doing that, it meant that we had to grow. Fatima talked about our capacity, growing our capacity. Yes, for the longest time, there was only one of me. But even then, it wasn't my work. It was the work of our coalition that were supporting, the person that I was in that role by myself. So I had a collaborative of organizations and volunteers that were, coming to our ends. But internally, as we started seeing these communities grow, it meant that they needed to be supported financially. So Merck stepping up, which is one of our mission is to grow, grassroots and support them, was to step in and fiscally sponsor them, because as you know, the Department of Health and Human Service contracts, those are federal grants. The financial administrative, reporting that's required, these grassroots would never be able to do that because they don't have those structure, but they should not even be made to have those to have those structures, they should be able to be supported in a way that they can continue providing services. And so Merck has stepped in, to strengthen our fiscal sponsorship program, which they don't pay. We're just a pass-through. Today, I have to sit, I think the DHHS people are looking at me. Yeah, I haven't finished my financial report. I'm gonna finish it tonight. It's due tomorrow. So we have these reports that we have to do, and Fatima is always emailing them, send us the invoice, send us this, because so that when we get audited, we're actually just finishing up our audit. Thank God it's almost done. Which we are required by federal to do that audit. Again, I'm not number person. I'm so glad, we have Kiri coming in and taking over that. But, it's a beauty for us to be able to see our communities grow and touch their people without feeling the stress of, we won't be able to cross this T financially, administratively. We are here as Merck to step in and provide that administrative support. And these structures, like I said, are now being used, even within, trying to support these communities that are right now coming in from the border, coming into Maine, or whether they're flying in as the Afghans are doing that. These are the same structures. This last week, we just saw the Afghan community come together, form an organization, elect leaders, and Merck is stepping in. They're using our office these last 2 weeks to bring their communities here, help them apply for humanitarian parole, help them with any applications that are, that they have to, whether their families are already here, they're still coming in. So they're using the Merck space to be able to do that. But they're building onto this system that we have created collectively as ethnic-based organizations, but with the support of, the CAP agencies and DHHS. And it's a beauty for us to be able to speak about when you support ethnic-based organizations, they know how to support their people. We can become, our tagline, Jayde, can you go back to the first and second? Our tagline, and I looked at it over the years, when will we ever, enhance our immigrant lives, to strengthen Maine? In this past, year, from actually 2 years, from 2019 to where we are now, we can see a stronger Maine because our ethnic-based organizations are stronger. So thank you so much for joining us, and we're happy to answer any questions. We do have a resource link that you click on it. It's on our website. It can take you to every information that most of it that we have been sharing, but we also have grown an ecosystem map that just can get overwhelming, but it helps you see how we are organized. But it helps you see if you're looking for, well, I don't know where I can find immigrants that do this. You can find that on our website. We've also done an extensive needs assessment from the 2019. We're actually using that needs assessment from the Expo 2019 to look at the current Expo 2.0 that's on our doorsteps as I'm speaking, and then using also that system, like I said, to support our Afghan communities as they are coming in. The Catholic Church has stepped up because they're the refugee resettlement organization, but those people that are coming in through the Catholic churches, they live in our communities and are connected to our communities. And so please, take some time to look at our website and look at referrals. There's a link that's not working. Please send that to Jayde because she will fix it immediately. And, our contact and our email is right there. So thank you once again for joining us. And we look forward to strengthening Maine as we all, live in Maine. We're not going anywhere. Somebody asked me, when are you going back? I am not going back. But I visit my home. This is home for me too, but I'm not going back. So thank you so much.
Thank you so much for that wonderful presentation. And I just want to share, you have several comments in the chat congratulating and thanking you for the tireless work that you're doing and being champions of culturally appropriate services and for uplifting everyone's work. So I just wanted to share that with you. We do have some questions that have come in, and Mufalo, you ended talking about the ecosystems map. And one of the questions is if you can talk about the development process for creating that map, and if there are plans to dive deeper into it and look into relationships and partner capacity and focus areas.
Jayde, do you want to take a stop at that?
So I can talk about the development of it. So we worked with like an outside contractor who did a lot of the design of it, but what we really wanted was like a central place for all of our member and partner organizations. So it was collecting their information and kind of categorizing them into their like main service areas, and then also providing like a link to their webpage, a little blurb about them. So it was all done. I'm not sure what platform it was done on originally, but right now it's done using a platform called Kumu. And I believe it's free, and you can create like really cool, interesting, different kind of ecosystem maps, and they're all interactive as well. So that was something that we were able to transfer to a different platform and do it more in-house as well.
And I will add again, that was also financed by the city of Portland's CBDG grant. And so, so thankful to have been able to get financing to be able to provide that platform. But in regards to what you can do, absolutely, you can do so much. And now as we're growing our capacity internally, we'll be able to dive deep into relationship, because, and we noticed even when we were designing that and looking at the different maps that, that vendor has been able to provide, that we could do so much within Maine. And as we are now, looking, especially with, like I said, building onto the structures that we have, we'll now be able to dig deep into that work. But we do have the capacity to be able to develop ecosystem maps around relationships and stuff. So we can do so much, especially within our ethnic-based organizations who are very, very diverse, that it gives a better understanding, when you get to see it on paper, which is what that ecosystem map does for us.
Great, thank you. And for folks who haven't seen it, the link is shared in the Q&A and in the chat as well, if you'd like to check it out. On the theme of capacity, you talked about linking people to community agencies and organizations to meet their needs during COVID. Do we in Maine have the organizational capacity to meet all those needs? And is that capacity culturally appropriate?
Well, I think I will take a stab and anyone can talk about that. We, again, financially, we don't, because it's expensive, and we saw when COVID money, came into the different states, it was first initially channeled through Catholic charities. But we advocated, immensely for ethnic-based organizations to get funded directly from the state. And one of the reasons we did that was post the pandemic. These organizations can also know how to contract from the state, how to access some of these resources that they have not been able to do because they don't have experience to do that. And so it is, in terms of capacity, we don't, but that's one of our advocacy, initiatives going forward, is to advocate for that, capacity to grow, because without funding, these ethnic-based organizations, will stay, will stay unequipped to be able to provide those services across. But the other piece also is, finding ways, which we have learned during the pandemic, finding ways to work collaboratively with mainstream, because that has strengthened our work too. So they're also not replacing us. We're not replacing them. They don't need to do our work. They just need to find ways of knowing how to work together. But that also means that their expertise that they have, that they cannot provide, instead of replicating them, they can subcontract our ethnic-based organizations to provide that service. It strengthens them and it strengthens our organization. And so that is a place where that the capacity can be able to, we can do that tomorrow. We just need to change budget lines instead of mainstream going to hire one person to try to lift a whole community, which is not possible. It's not a solution to hire me in a big mainstream organization to be able to lift the Congolese community. You're talking about 15,000 people. How can one person be able to do that? So subcontract the ethnic organization and then have a lead person within that organization to work with you as a mainstream organization, instead of putting one person, which is literally a drop in the ocean. If you put them in your organization and expect them to, they will lift the ethnic organizations. It's impossible for me to do that. I'm not sure how it will be possible for one person, whether it's in education or in childcare or whichever area. It's impossible to have one person. So that's the capacity. We do have some capacity that we could do, because in mainstream organizations have the budget, have the money. They can work with our organizations to be able to do that.
Thank you. And, I think we've heard a lot today about collaboration and working directly in communities and with the people who know, what are the services that they need, go to the community members and the community organizations to find that out. We have a question that's similar, but slightly different. It says that you seem to do so much to bring in diverse groups to prevent and respond to public health needs. What parts of the system that exists and is funded by the COVID federal funds would you recommend stay in place for emergency preparedness, response, and social mobilization?
Mufalo, do you want me to answer that?
Yeah, go ahead. Yeah, no, I was speaking, I was on mute.
I can answer that. So as Mufalo was talking about, I personally really don't like the way people use sometimes the word diversity, because it literally means, again, it's bringing one person and giving the responsibility or representing a whole group of people. And that is a burden rather than help in long term. So one of the things that I think, and being the point person for our ethnic organization, 21 of them, their needs are very different. So it's not just that one glove fits all, But one of the things that I think that should stay in the long term is the contracting with our ethnic organization when the case of emergencies, like our referral system, because in the long term, when we are talking, and yes, there are a lot of people coming from the global south or Asia or like the whole continent of Africa, but this is not going to end. We are talking about, we are now thinking, Mark, we are thinking about global warming and what is that going to cause in the long term. And when immigrants are going to come, one of the things that I think it would be very beneficial for the state of Maine and for and also for our communities, because that would not be, we don't have to constantly take care of each other without being having the money. We are already stretched very thin. So the state has to continue funding this ethnic organization, and the funding, everything ends and start with the money. If these ethnic organizations, they have the money, they can build the capacity and they can help their people. They can help the community grow, and and that's what really equity is. Equity doesn't start from mainstream organization trying to help diversify their place, because that our people would not go. Even if they go there, it's not equitable, it's not culturally appropriate for them. There is a lot of things that needs to be done. It hundreds of years or programs need. But if we, as Mufalo was talking, if we directly fund our ethnic organization in Maine, they are really the backbone of our equitable and equity work in the state of Maine. And I think that as someone who has seen how much they work, and some of our almost all of the people who are members of our ethnic organization, they have 2 jobs, 3 jobs to help their own families. On top of that, their weekends and the other time, I always have meetings with them after 5 o'clock, because during the day they have work, or on the weekend. So these flexibilities, and they do so much, and they work from a place because it's affecting their family, it's affecting their community, and they know if they don't do it, the people would keep coming because they don't know anyone else, they don't feel comfortable, and the trust they have already built it. So we should continue funding these organizations.
Thank you. Jayde?
Yeah, I would just also add that I think keeping the social services referral system in place, especially, dealing with any kind of emergency, but just in general, just helping people access services. I think that is definitely a theme that, and is an ongoing issue that COVID just really brought to light, is just access issues and just knowing where to go for your services, and having people that can help you navigate those systems. And I also think that the whole referral system, what was really special and important about it was that it wasn't just something that the state was doing and it's like expecting all of the community-based organizations to just fit within it. It was really molded through like a collaborative effort. And I feel like the community leaders really had a say in how things were done and in what worked for their communities. So I think that not only the whole system as itself, but the whole kind of culture and collaboration around the system is something that is really important to keep going, moving forward, supporting the immigrant community in Maine.
Thank you. And we did have some folks echo in the chat the importance, as you're saying, of mainstream organizations contracting with the ACBO. So thanks for discussing that. I think it's an important issue that not many of us have thought about. We have another question. This one's easy. I think if you could, they'd like to know where the list of the 17 languages can be found that you translate your documents into. Is that on your
website?
Okay.
Yeah, everything is there on our first page, so you can just go. There is a line of things. So
thank you. And the last question we have time for is, if organizations are interested in joining your coalition or partnering with your work, how should they go about doing that? Who's the best contact?
They can email me directly, but we only admit organizations. I'm sorry for those organizations. The only organization we admit are the ones that their main focus are immigrant or people of color. So I apologize in advance. We would like to partner with anyone who wants, but again, thank you for being interested. But I would love to have a conversation and, learn more about your work.
Yeah, Fatima is the person to email. But there's a link on our website, like she said.
Thank you. And in the final minute, are there any other closing thoughts you'd like to share with us?
Well, personally, I think it's been a beauty, to see, our communities feel seen in this last one, especially 2 years. It's just been a beauty for them to be seen, but it's also painful because somebody sent me an email and asked me how, like, does it ever slow down? And I was telling my husband, I said, my work is my life. And as much as I want to step away, I can't, it's not like I don't step away. There are reactionary issues that come up. And so, it's been a beauty to see the collaborative, but it continuously is painful because you feel the pain of people. You've seen what's been happening at the border. Seen our Haitians, people being deported. There's just pain around that. Our work is painful, but it's also beautiful when we can see folks accessing the need, when we can see, us being there for someone. So thank you for this opportunity. Jayde.
I think you said it beautifully. But yeah, I mean, I came into this work straight out of graduating college, kind of graduated into a pandemic. And I think that this is just the most incredible thing to be a part of. Very, very difficult work, but so important. And I really hope that moving forward into the future that, this work continues, and this work and the hard work doesn't only fall on the community-based organizations, but also on a lot of mainstream organizations that are kind of upholding these systems that continue to oppress and continue to discriminate and, create these disparities and create these inequities. So yeah, I'll leave it at that.
Thank you, Jayde and Mufalo. I think as Mufalo said, this work is a curse and a blessing all at once, and you feel it. You just really feel it in your bone, and you feel it in your heart, and you feel it in your soul. But it's Mufalo constantly sometimes says that we are flying the plane as we are building, but we are building it in a way that we know our community what they need, because we come from this community. So it is built, our plane is a plane of equity, a plane of justice, and the way we stand for our people. I think being an African American, I saw how all these ethnic organizations, when they have nothing, they came out, and how they, in the past few months, and how they've been so supportive to the Afghan community. And I think that's one of the things that I'm so proud of this work. And I when we were interviewing, I was just so for our new position, I was just keep saying our work is not just a work, it's a movement. And that's what is so a lot of the pain come, because when I go home at night, my work doesn't end. My work is in my face, my work is in my accent, my work is my identity, and it's constantly going. And that's why I think it's so emotional sometimes, but also it's just, I feel so proud because I know how much Maine has grown. I have seen it, and it's so beautiful to see it. And I'm so blessed to be behind and standing on the shoulder of so many women, so many men of color, so many immigrant and refugees that have done so much for the state of Maine and for our people and for the generations to come behind us. So thank you.
Thank you all so much. And I don't think we could have ended on a better note. And I know we're in a virtual space, but I really think if we were together in person, you would be getting a standing ovation right now for all of your work and your dedication. So thank you so much for presenting today and for all that you do. We do have our next session coming up where we will be recognizing Representative Rachel Talbot Ross for the Public Health Policy Champion Award. And we will be hearing from her, Ian Yaffe, and Deb Dietrich about advancing racial justice in the Maine legislature. So we will see you all back here at 12:10. Thank you again to our presenters and to everyone for attending this morning.
Thank you.